I'm here with Dr. Cotterill. Our patient is in the next room. Before we get to the patient, because we're doing a live surgery here on Breakfast Television this morning, a hair transplant, I'm going to talk to Dr. Cotterill about who is a good candidate for hair transplants.
Well, not everybody's a very good candidate, but as long as you have adequate donor hair at the back of the scalp and an appropriate area where to put it, then you can have transplants. But really the main reasons for doing hair transplants are from male pattern baldness or female pattern thinning. 1 in 5 women have some degree of thinning, and 50% of men by the age of 50 have some degree of male pattern baldness.
Okay, so let's talk about the pictures that you have right here. Let's talk about male balding patterns.
Right, male balding patterns. The typical balding pattern is where you lose the hair at the front half of the scalp but maintain a good donor fringe at the back. And with transplants we can, reconstitute the hairline and give you back, a very nice hairline. Again, typical male pattern thinning in a 20-year-old who's had 1 session here, which is given back his frame, and the frame is what makes you look your apparent age, and so that's really the area to focus on.
Women, let's talk about women's eyebrows.
Eyebrows are certainly are very good for transplantation. This is a woman in her 20s who plucked out her eyebrows when she was young, so that's just eyebrow pencil.
Yeah.
And so now we've done transplants to give her back her eyebrows. That's a couple of sessions of transplants there, and this is with her full makeup on to make it look as full as possible. So
excellent.
Eyebrow transplants here. Another example, this woman had a basal cell carcinoma, a little cancer which was removed, so we transplanted the area to give her back her eyebrow once the surgery was finished.
Makes her feel better, a better self. Right here, this is a woman who had plastic surgery.
Yes, this is actually an actress from the States years ago who in her late 20s was convinced by a plastic surgeon to have a facelift, and you can see there's scarring back here, raised her hairline back immensely. So she came to us and we lowered the hairline down. Do you see the black line I've drawn on there?
Yeah.
We're bringing the hairline back, and this is after 2 sessions of transplantation. She now feels much more comfortable about getting back up on stage.
And this one, which is fabulous, because this is a burn victim, and you work with burn victims.
Yes, patients often can have their procedures covered under OHIP if it is not from typical male or female pattern thinning, but from a burn, if it's at the hairline. And this woman, at a young age as a toddler, had hot water poured on her scalp, unfortunately. She became an opera singer, was very concerned about getting up on stage, so we did some transplant to cover the burns and give her back her hairline, and she was very happy with that as well.
And of course, very quickly, transgender as well.
Transgender patients as well, male to female. This is a male who's wanting to become a female. Obviously doesn't look very female at this point, so we're going to be giving her back her hairline in a more female pattern distribution, which is a lower hairline. And then we have another photo just showing you where she's had some hair put back in to give her some more.
There you go. Well, thank you very much. We have a patient, Robert, who's waiting in the other room. We're going to do the transplant surgery live on Breakfast Television. We're going to head back to Liza, and we'll see you when we come back. The reason why I like Dr. Cotterill is because when he was 16, the reason why he got into this business, when he was 16, you started going bald yourself.
That's right.
That must have been pretty tough.
It was really bothersome. My self-confidence went down completely. I wore a baseball cap all the time. But had the transplants, and it really boosted my self-confidence.
And you wanted to do that for other people.
That's right.
Like Robert Gage. He owns his own salon. He works with hair all the time. You're a famous hairstylist, and now you're getting this done.
I am.
And it doesn't hurt.
Not a bit. It's easy, fun. Actually, it's fun.
It's fun.
Well, it's a nice morning. Yeah, it's great. It doesn't hurt. And
this is the 4th time you've had it done. You can get it done, obviously, over and over again. How many times can you do it?
Well, really, it depends on how bald you are and what happens in the future. But some fellows come in when they have early thinning. They might just have 1 session and then maybe 10 years later have a 2nd session. Robert here started when he had a fair amount of thinning, but we've been replacing what he's been losing. So today he's in for a touch-up. So most of this hair here has all been transplanted over the last few sessions. And what we want to do is just refine the hairline a little bit more and give him some more hair in the crown back here.
Okay. Now, where are we at this point? Again, I said if you're a little bit squeamish, just turn your head for a minute and let's talk about what we've done and what we're doing.
Well, at this point, Robert came in earlier this morning and we designed what we were going to do, but I've already removed the donor strip, and that's the permanent hair from the back of the scalp. Robert, if you could just lean forwards for a second. So this is the area that one of the areas where you've taken the hair from, and you see some sutures here. So a strip had been removed from here. It was about 9 millimeters wide and about this long, and then it's been sutured closed. So when this heals, he'll have a very tiny little pencil line thin scar, which will be camouflaged by the hair he has.
You won't see it.
Right. So then that strip was taken out and taken over here to where it is being dissected with microscopes and really good vision.
We got 3 ladies over there dissecting, and they've been working very hard all morning, and they're dissecting and
Right.
the hair.
Right. You take the graft and you dissect it into something called follicular units. That's the new buzzword. And really, hairs grow out in discrete bundles of 1, 2, or 3 hairs. And you want to keep those bundles intact. And so when we transplant now, long ago are the days of the big circular plugs, which look like rows of corn. They might have had 15 to 30 hairs in each graft. Now we transplant literally 1 hair at a time, and gives you a much more feathered look, such that even one session can look really natural. And so today, we're now doing some more one-haired grafting to the hairline.
Okay, so continue with the grafting.
Okay.
While you do the grafting, we're going to take a break, and we're actually going to see it when we come back. There we go. And we'll see you in just a bit.
Right now, we've taken out the donor strip. The
Yes.
grafts are being dissected, and I've already made some sites at the front of the scalp with a very small needle to accept 1- and 2-haired micrografts.
Can we see it
which
actually
will be going
go
into
in
these
here?
sites. Absolutely.
Okay,
I'll
get
make
it.
some more sites for you.
Just turn your head, because this is what happens. And Robert, you can't feel a thing.
No, nothing.
So this area is all anesthetized, and I'm making my little sites very carefully in between the hairs.
Yes.
And in between the pre-existing hairs.
Okay.
Just like that. You just go down just a little bit in through the skin.
Mm-hmm.
Be very careful with angle and direction and spacing.
It's like bunka.
Which he does the best. Which he does the best of. He does the best hairlines of any of the
Well, hairlines
surgeons.
are very important because that's what people see straight on when they look at you. And you don't want to have a hairline that looks clumpy or irregular with big gaps and spaces. You don't want to have a graft with too many hairs in each graft, or again, it looks toothy. The old-style transplants were the large circular plugs, looked like rows of corn.
Yeah.
And they worked very well if you had 4 to 5 sessions. But if you only had 1 session of those old grafts on a bald scalp, you looked really bad until you had further sessions. With today's techniques, even 1 session stands on its own very well and can blend in just great.
You're transplanting 2,500 hairs today?
Yes.
And they're not falling out, right?
No.
It's like your own hair. It grows, you can dye it, color it.
Exactly.
It is your own hair.
It's your own hair, just rearranged, so it's going to grow at the same length, color, texture, and so forth from where we took the hair from.
While you're doing that, I just want to point out the 3 ladies at the back there. I don't know if you guys can wave over there. There's Lily and Kelly, and Andrea. This is pretty incredible. This is Robert's skin on the chopping block here, and they're taking out the hair.
Yes, once we've taken out the strip from the back of the scalp, then it's taken over to the microscopes where it's slivered. The larger chunk of scalp is then cut up into smaller, discrete pieces with the use of the microscope, and then from there, we take those small pieces and then divide it even more carefully into 1- and 2- and 3-haired follicular unit grafts.
And you're transplanting it into
Right.
Robert's head.
Exactly. And then once the graft is in place, then there's a little bit of blood that forms on the graft. It's like biological glue, which holds the graft in place. It forms a crust overnight. The crust starts to fall off in 7 to 10 days. 10 days to 2 weeks later, it looks like he won't have anything done. It will heal beautifully. The little hairs initially fall out, but then will all start to grow in 2 to 3 months. I specialize solely in hair restoration surgery, but in this clinic as well, we have Dr. Penny Kendall-Reed, who's a naturopath, and she specializes in weight loss and stress reduction and anti-aging.
Okay.
And then we also have a medical esthetician, so we also offer laser hair removal. I have a lot of patients who have too little hair in their head, but too much hair in the rest of their body, so it's a good fit.
Robert Gage is our patient. He's been wonderful this morning. You've been doing a great job.
Thank you.
What are we doing right now? We've got the 2 girls over here. You've already, you know, I don't want to say put holes in his head, but...
Well, I've made lots of little sites with
Okay.
a very small instrument to accept the 1- and 2-haired micro or follicular unit grafts at the very front. And then a little bit further back is a slightly larger site which will accept a 3-, 4-, or 5-haired graft. So the sites have been made, or some of the sites have been made, and Lily and Kelly are now planting the little grafts using something called jeweler's forceps to very gently place the grafts into these sites.
This is so cool.
And then these sites will stay in place. They will form a crust. I think I mentioned before they'll
Yes,
start
you
to
did.
fall off within 7 to 10 days. So as long as you don't hit your head within the first week or actively try to pick one out, they won't come out on their own.
Yeah, you're not going to try to pick one out.
No.
And you should take a week off work. You recommend taking a week off
I
work?
do, especially if it's your first session, because you can get swelling in the face. Whenever you do surgery, because of gravity, the swelling can sink, and
Yeah.
1 in 50 patients get black eyes, 1 in 50 patients don't get any swelling. But you never know, so you want to make sure that you don't go back to work in 4 days with big black eyes. But
No.
1 week, they're gone if you have them. No sports or heavy physical activity for 1 week. The sutures that I put in, Robert will be coming back next week to have the sutures removed just in the donor region. And then all the hairs will start to grow definitely in 2 to 3 months.